and welcome to Local Doctors on Call. I'm Alix Redmonde. Although we had planned on discussing skin cancer tonight, we'll talk about that in a special October show. Because August is National Hair Loss Awareness Month, we decided to talk about hair loss and address this very sensitive topic. Just think about it. What can be worse than running your hands through your hair in the shower and watching tons of hair going down the drain? Noticing your hairline visibly receding as in male pattern baldness, or seeing a naked patch of skin where hair was once abundant. Losing our hair can lead to poor self-esteem, embarrassment, and depression. Hair loss doesn't discriminate. It affects the young and the old, men and women. But what can you do about it? Well, Dr. Heidi Anderson is back to answer your questions about hair loss. She's board certified in dermatology and trained in pediatrics. She attended the University of Cincinnati School of Medicine, and she's a member of the American Society of Cosmetic Dermatology and Aesthetic Surgery. Welcome back, Dr. Anderson.
Thank you. Nice to see you.
Yeah, it's good to see you as well. And tonight we're talking about, it's a very sensitive topic. I think also we're going to open up the phone lines, because if there is someone out there and you have someone in your life, or maybe you're going through hair loss, it's a great opportunity to speak to Dr. Anderson before you even have to make an appointment. And our live call-in number is 361-4675. That's 361-4675. Don't be shy. Pick up the phone. We'd love to hear from you. What's the number one reason that you feel people have hair loss?
The broad category would be hormonal hair loss. Most people would jump onto hormones like testosterone or a fluctuation in estrogen. But with that overriding category of hormonal hair loss, you throw in thyroid disorders, because thyroid's a hormone. You throw in cortisol, stress, because that's a hormone as well. So it's multifactorial, but hormonal hair loss is the number one reason.
Is there a certain time in a person's life that they will have more hair loss than others? Would that be maybe women going through menopause or young girls going through puberty?
Some of the hormonal hair loss, like the typical testosterone or estrogen, absolutely. There can be surges or there can be lulls in hormone production. The body's pretty smart in that it realizes hair and nails aren't necessary for everyday function. So it may compromise and take its energy away from hair or nail growth in times of stress, and it might compromise that.
Now, with testosterone and the hormone level, the estrogen,
Sure.
So does that seem to hit people when men are of a certain age and they start to get more estrogen or lose testosterone, and when women are in their 50s and they get a little more testosterone going on, or they start to lose their estrogen?
There is definitely a genetic pattern, as well as your hormonal levels. But honestly, for women, it's actually a testosterone breakdown product that affects the hair follicles. For men as well, it's actually a testosterone breakdown product that attacks hair follicles. So we have some options to hormonally block some of those high levels, but for the most part, as we age, the hormonal levels fluctuate and can affect hair.
But there is help for people that do have hair loss on probably quite a few levels.
Multiple levels. You know, when we talk about what types of hair loss, we really divide it up to scarring and to non-scarring. Scarring, of course, unfortunately, takes away those hair follicles deep in the tissue. You know, people will joke around sometimes if I have to freeze something on the scalp, a precancerous lesion, they'll say, oh, do you stimulate hair growth? Will this take away my hair? But the hair root is pretty deep. It's beneath the epidermis, beneath the dermis, in the subcutaneous tissue. When you think of all the trauma we put through hair. So we actually are pretty fortunate that it's so deep and so strong.
So if we go ahead and burn our scalp with the hair dryer, or we go ahead and hit ourselves with the hot iron, do we have to worry that that's gone deep enough?
Depends on the degree of the burn. If it's just a quick singe, no, you're going to be fine. When we go back and talk about the non-scarring, the majority of hair losses is non-scarring. So you have the capability of typically being able to regenerate some hair depending upon the hormonal levels and things like that.
All right, if you'd like to ask Dr. Anderson a question about what you can do about your hair loss, the number is 361-4675. That's 361-4675. And we are talking about hair loss and what you can do about it. How many people are affected by hair loss in the United States? Is it hundreds? Is it thousands?
Millions. Probably because sometimes hair loss is temporary. When we talk about the hair cycle, there really is a growth phase, a resting phase, and a loss phase. Typically we lose about 100 hairs a day. None of us notice it. But many things can shift us into that greater shedding phase. So depending upon life stressors, you can lose more than that 100, and that's when it starts to become very noticeable.
Does it affect men more or women more? Who loses more hair?
So on average, it's pretty much even because of that 100-day shedding, or that 100 hair shedding a day. But if we subcategorize it hormonally, probably men have a little greater propensity for hormonal hair loss. When we start to get into more of the scarring and more of the autoimmune disorders, genetics play a much bigger role.
Well, let's talk about the different types of hair loss. I know that somebody can lose all of their hair. Can that happen overnight, or is that an over time thing?
So you're kind of going into the category of an immune hair loss. One of the subsets, or one of the smaller categories of non-scarring. So immune hair loss, commonly known as alopecia areata. So alopecia is a term for hair loss. Alopecia areata can be as small and simple as a little patch. It can be total scalp, or it can be scalp, eyelashes, eyebrows, all body hair as well. And you can imagine how traumatic that is. But it can happen at any age. It's a little bit more gradual, but I definitely, unfortunately, have patients that are young with alopecia areata that have lost all scalp hair, and it's kind of happened over a 6 to 8 week period.
And is there any hope for them that it will grow back naturally? Or
if it starts small, so we say focal, patchy, small circles, we do have the capability of, it's pretty much their immune system is revved up. They're super healthy. I actually had one child today, phenomenally healthy. And their immune system, for some reason, attacks their hair follicles. You can kind of trick or distract the immune system, or even calm it down. But when you have someone that's progressing, and it's their whole scalp, it's really hard to do a lot of the medications without causing harm. So that's kind of the balance. Is the immune system just running rampant? And if I give them something orally by mouth, am I only just temporarily affecting their hair growth? And am I going to cause them more harm than anything?
with a child, is it less likely to grow back, or more likely over time that they'll get out of this condition as their bodies change?
Depending on what type they have. If they have full body, there's really not many options. If they have scalp, a lot of times we kind of also look at that cortisol level, that stress level, their emotional support, and see if there's any other factors. We look at, hopefully maybe thyroid played a role and we can help them. Maybe iron levels or anemia. But the greater amount of hair loss they have, and as rapid as it came on, if there's anybody else in the family, those are the ones that we don't have as many options. There is a fantastic Alopecia Areata Foundation where there's camps. They can be pen pals to other kids going through the same aspects.
All right, we have a phone call. We have Betty on the line. Hi, Betty. Thanks for calling Local Doctors on Call. What would you like to ask Dr. Anderson?
Dr. Anderson, is it possible that blood pressure medicine can cause hair loss in a woman?
Betty, thanks for mentioning that. We spoke a little bit about a category called telogen effluvium, and telogen is your normal hair shedding. But there are many medications that will cause shedding. Some medications like Accutane that I use in teenagers, absolutely some blood pressure medications will shift the hair into the shedding phase. Sometimes the shedding phase can only be an adjustment, 3 months, maybe max 6 months. Sometimes small percentage actually have chronic telogen effluvium. But often blood pressure medications can just be a brief 3 to 6 months, and then the body normalizes again.
All right, Betty, thank you for your phone call, and the phone lines are once again open. If you would like to call in, we'd love to hear from you. Our phone number is 361-4675. 361-4675 with your questions about hair loss. Is it possible to lose hair from one area and then it grows in another area, like compensating for that loss?
Great question. You know, if you think about it, for women, for hormonal hair loss, you will hear women say, why is it that I'm losing hair here, but gaining hair here on the chin. And that partially is just the effect of that testosterone breakdown product, where it sheds it on the scalp and then it kind of, for some reason, stimulates it on the chin. So that's really the only condition that I know.
All right, we're going to go ahead and take a little break, and when we come back, we will take more of your phone calls. The number is 361-4675. That's 361-4675. You're watching Local Doctors on Call. Please stay with us. We'll be right back. Welcome back to Local Doctors on Call. I'm Alix Redmonde, and Dr. Heidi Anderson is talking about hair loss tonight. She is of Dermatology and Oculoplastic Consultants. And we do have a phone call. We have Susan on the line. Thanks for holding, Susan. What would you like to ask Dr. Anderson?
Hi, Dr. Anderson. I have a question. My husband seems to be, he has a light beard, and he has spots on his face where the hair has disappeared, and the hair is not growing back there. And he also has one spot on the back of his neck where his hairline is. It's just a clear circle, and he doesn't have any hair there. It's like baby skin. I was wondering, I mean, he's gone through his physical. He's had his thyroid checked. Just wondering what's causing.
What you're describing does sound like patchy or focal alopecia areata, so almost perfect circles. Very appropriately, I would check the thyroid as well. I would take a pretty detailed medical history to make sure there was nothing else of concern. I would also check iron and iron stores. Alopecia areata was the autoimmune hair loss category that we were talking about. A lot of times if it starts very small and patchy in those circles that you're describing, we can use a topical steroid or even inject the area with a steroid to try to get that immune system to not go after those hair follicles. So if it bothered him, this is the time early when you would actually try to do some intervention and a little bit of investigation to see if we can grow some hair back.
Susan, thank you for your phone call. And if you have a question you'd like to ask Dr. Anderson, you may call 361-4675. We are live tonight answering your questions about hair loss. The number is 361-4675. And we have Elaine on the line. Hi, Elaine.
Hi. I have a question.
Yes, go ahead.
And I heard recently that omega-3 may cause some hair loss. I do take that, and I have had hair loss in the past. I started taking biotin 5000, which really helped, and then I started noticing a little bit more hair loss, and I was wondering if it was attributed to this omega-3 or the amount that I am taking. I wonder if the doctor...
First of all, your biotin supplementation is very appropriate. 5,000 micrograms of what you're taking. And biotin is used for the nutritional support of hair growth. Omega-3 is interesting. It's not one of the common medications that I ask people if they're on. But when we talked about the blood pressure phone call earlier, medications can shift hair into temporary shedding. There's not an amount of omega-3 that would cause you to have more shedding. It's not one that we commonly are concerned about, but it does fall into a risk. Typically, we, though, would look and see some stabilization around 3 to 6 months into it. It's tough, though, because omega-3 does beautiful things for your joints and for your heart, so it's a little bit of a trade-off to make sure what matters most.
All right, thank you for your phone call. Phone lines are open. If you'd like to call in with a question, the number is 361-4675. That's 361-4675. Dr. Heidi Anderson of Dermatology and Oculoplastic Consultants is here answering your questions about hair loss. Let's talk a little bit about the two treatments that came out years ago that were so popular. I remember I actually had a boyfriend that was losing a little hair around here, and he started putting on the Rogaine, and he had to put that on every day. Is that still the standard for men? And I believe it's minoxidil, which is for women?
Great point. So minoxidil is the parent medication, and it comes over the counter topically in either a 5% or a 2.5%. Men also have a little bit of a better option because they also have an oral pill called Propecia. We can use it on gentlemen, but not so much women, rarely post-hysterectomy. So minoxidil totally came out by coincidence. In a high dose in a pill form, we use it for blood pressures. And people noticed that people started to have hair growth. And When it went low side effects, we turned it into an over-the-counter medication. It's an over-the-counter solution or an over-the-counter foam that can do two things. One, it could slow down shedding, and that's what I tell most people. You may notice a loss, a reduction of your loss. The second, which is a little more unpredictable, you may be able to grow hair back again.
So you're probably more likely to see that your hair is not falling out as much,
Right.
but you may not notice that you're having tremendous growth.
Absolutely correct.
All right?
Yep.
Our phone number is 361-4675. That's 361-4675. And Vicky's been holding on the line. Hi, Vicky. Welcome to the show. What would you like to ask Dr. Anderson?
Hi, I have a daughter that's 25, and she has been, I guess, to an endocrinologist in Chicago. That's where she lives, and been actually suffering for a year with hair loss. You know, just in patches. There's just certain places it's just kind of falling out to the point where, you know, she's pretty distressed and is having to go look for a wig. And she's been through all the blood work. Everything checks out normal. They've checked her thyroid. They actually just recently did a pelvic ultrasound. Still haven't gotten the results back on that. No history of alopecia at all, and I'm just wondering, you know, we're at a loss. We know it's supposedly some hormonal imbalance. She takes excellent vitamins and good care of herself, sleeps well, but you know, we just don't know where to turn. You know, for 25 years old, it's pretty distressing. So
It is, and I'm sorry that she's going through it. I really am. One aspect is it doesn't sound like a biopsy of the scalp has been done. And a biopsy of the scalp should be done because underneath the microscope, if it's hormonal hair loss, what actually happens is the hair follicles miniaturize, so they become smaller. They also sit higher up in the scalp, so they look different. Telogen effluvium, that emotional shedding that I was talking about, which can happen with medications, surgery, stress, birth, that actually, you can actually see the type of hair that's left over. It's a telogen hair. Then when we talk about alopecia areata, that autoimmune disorder, you kind of go on an edge where the most recent hair loss has occurred, and you can see inflammation of immune cells around a hair follicle. So it sounds like a biopsy should be done. Many times with alopecia areata, we find no reason. They are the most phenomenally healthy people. And again, it's just that confused, overactive immune system. So it might put you all a little bit more comfort to do a biopsy. And there are absolutely people who are specialists in looking at hair underneath the microscope. And you can kind of work with a dermatologist if she's up in the Chicago area that can help her. But that would be primarily my number one start. Number two, if alopecia areata becomes your working diagnosis, then Alopecia Areata Foundation is very, very important. We also talk a little bit about, you know, so much of dermatology, we also delve into psychology. And because this is something that at such a young age she may have to deal with for a very long time, I usually do work in yoga, biofeedback with a psychologist if it comes back that it's alopecia areata. So I think there's still some hope to be able to get a little bit more of a crisper diagnosis.
All right, Vicki, thank you for your phone call. And if you'd like to reach out to Dr. Heidi Anderson, you can reach her at her phone number, which is 941-925-DOCS. It's an easy one to remember. That's 925-DOCS. Or simply go online to skinidocs.com. And maybe if your daughter's in town visiting, you might want to just take a quick tour over there and speak to Dr. Anderson, because there may be a good comfort level there as well. Mm-hmm. All right, so we talked about this young woman that's having problems right now, but what about also for people that are having loss of eyelashes and eyebrows? I know that there's a product on the market, Latisse,
Sure.
that works very, very well,
Yes.
but does it work with people who are experiencing some loss?
So it's questionable if it's chemotherapy, because that's a lot of my patients will ask if they're going through or after chemotherapy. But thyroid disorders will cause a little bit of recession of the eyebrow. Whether we like it or not, the aging process causes some recession of the eyebrows as well as eyelashes. Latisse is amazing. It came about as a glaucoma medication. And so many people were getting that added benefit or bonus of long eyelashes. And so it is in the cosmetic realm by prescription, and it does a great job. Occasionally causes irritation, so there's a few questions you have to ask patients before you put them on it, but we absolutely use it for longer, lush, darker eyelashes and a little extra on the eyebrows. You betcha.
All right, it's a great product. You don't have anything separate that you use for eyebrows, right?
Nothing else separate right now.
I must say that I have used Latisse,
Yes.
and I found that it just really pumped up the eyelashes. You do notice after a few weeks, you notice that new growth is coming in, and it's an amazing thing.
It is, usually around week 10. New and temporary though. If you come off of it, you're gonna lose it. But a lot of people are almost addicted to it, which is great.
But the good part is you don't lose your eyelashes if you come off. They just revert to what they once were.
They go back to their normal pattern. Absolutely.
All right, we're going to go ahead and take a little break, and when we come back, Dr. Anderson will answer more of your questions. If you'd like to take this opportunity to call in, the number is 361-4675. You're watching Local Doctors on Call, and we'll be right back. Stay with us. Welcome back to Local Doctors on Call. I'm Alix Redmonde, and tonight we are discussing the very sensitive topic of hair loss. But the phones have been ringing, and if you have a question, you'd like to ask a question to Dr. Heidi Anderson of Dermatology and Oculoplastic Consultants, she's here. We're live, and the number's 361-4675. We would love to hear from you. 361-4675. All right, let's talk a little bit about what type of hair loss is permanent.
So in the category of hair loss, scarring versus non-scarring, unfortunately there are absolutely hair loss conditions that are scarring, and it just obliterates the hair.
I'm going to give the number one more time because I think someone tried to get through and we lost them. 361-4675. That's 361-4675 to call in. And also, if you'd like to get a hold of Dr. Heidi Anderson of Dermatology and Oculoplastic Consultants, you may go ahead and call 925-DOCS or go online to skinidocs.com. All right, so we were talking about what type of hair loss is permanent, and I believe that somebody was trying to call in. We lost them, but hopefully you'll call back, 361-4675. Is it all permanent? No.
No, it's not. Scarring alopecia, so certain conditions that obliterate the hair follicle, those can be devastating. And those we say are inflammatory. Such names like lichen planus, where people have no capability of growing hair back. There's also a new category that is called traction alopecia. Traction alopecia actually was most popular, oddly enough, after some Broadway shows where people had phenomenal headgears, and this kind of destroyed their hair follicles. So they did a lot of research and figured out sometimes people that put extensions or tight ballerinas, that tight hair bows and buns, or different hairstyles actually over time obliterate the hair follicle. We notice it mostly through the front, and that they can have that scarring. Sometimes autoimmune hair loss, when you just completely get rid of that hair follicle, is another one that's permanent, unfortunately.
All right, if you'd like to call in, the number is 361-4675. That's 361-4675 with your questions about hair loss. And we have Allie on the line. Hi, Allie. Thank you for calling in. What would you like to ask Dr. Anderson about hair loss?
Hello?
Hi.
Hi there. You're on the air. Go ahead with your question.
Okay. I'm sorry, I'm getting a little feedback, but I would like to know if it's in a circular pattern, if it makes a difference on your hair loss.
So making a difference, meaning if it's going to progress or if it's going to lead to scarring. Most of what we talked about was that circular or patchy hair loss called alopecia areata. Sometimes people will have hair loss that's temporary, and it can be to ringworm. So circular doesn't matter as much, but that pattern is pretty consistent for the earliest and most recoverable phase of alopecia areata.
All right, thank you for your phone call. And if you'd like to call in, we just have a couple of minutes left. We do have time to take one more quick question. The number is 361-4675. It's your opportunity to call in, 361-4675. We are talking about hair loss. What medical conditions could contribute to hair loss other than possibly someone on chemotherapy where obviously they're going to lose some hair?
So thyroid disorders, really, really common that people will be it's such a state of unrest that their body stops producing hair, they increase shedding. We talked that a little bit about the eyebrows as well as the scalp. So thyroid's a really common disorder. There are some infectious disorders, something called sarcoidosis, which can actually happen in the lungs for breathing. When I trained in Cincinnati, sarcoid was a lot more popular. It also hits certain ethnic groups as well.
All right, we have one more phone call, and we have Clydell on the line. Clydell, you have a short amount of time to ask your question. We want to hear it. Go ahead.
Certain medication I know cause hair loss. If a person stops taking those medications, will they have a good chance of having some regrowth? Or
okay, so if you're on a medication by mouth, we mentioned blood pressure medications. If you stop them, sometimes you can switch the hairs back into regrowth, but a lot of times medication-induced shedding is very temporary. So the benefit that that medication is giving you for blood pressure or for thyroid is so much more important than the temporary shedding that you go through. And so I usually say to people, wait it out about 3 to 6 months. We can add in Rogaine. So we discuss a little bit about Rogaine, and I can talk more about it if you'd like.
All right, if you would like to get a hold of Dr. Heidi Anderson, her number is 925-DOCS. Again, that number is 925-DOCS. Or you may go online to skinidocs.com. We want to thank you for taking time out of your very valuable day to watch Local Doctors on Call. Like us on Facebook, Local Doctors on Call. Post a comment. We'll see you next time. Remember, it's your health.